Appreciate that story. My name is John Bruchalski, and I am an OBGYN, and I'm 50 years of age, and I'm married with 2 kids, and I am deeply pleased to be a part of the Students for Life and the Medical Students for Life. And this talk was really geared for medical students. Are there any medical students here in the audience tonight? You're going to be?
Actually, one of the OBGYN oncologists.
Oh. That's probably one of the toughest residency programs, at least when I went through. I did that up at Georgetown, my onc rotation. What about yourself? Second year medical student. Super. Anybody else? Who else? Yeah, Leah.
Third year medical student.
Wonderful. And that's also a plant in the audience. We've actually worked together in our office back in Virginia. So this has been wonderful. And I'm here to talk about this issue of the abortion question, but I hope I can come at it from a different perspective. Pro-life, pro-choice, just show of hands, pro-life, pro-choice. Okay. Once again, I go give this, oh, come on in, ladies.
Sorry.
No, not at all, not at all. We just finished driving down from Charlottesville. I really want to talk about this in a different way tonight. And I hope that I can talk about this in about 30 minutes. So it's 7:05. I hope I finish up by 7:35, and then we can open up to question and answers. Because I really believe in conversation. And I go around giving talks to medical students and residents called How Pro-Choice Are You? So when I talk about the pro-choice side or the pro-abortion side, I say, listen, you really believe in this? You really need to kind of carry it out. You need to do them. And the reality is that the vast majority of people don't do that. They have an ideology, but it's very hard to actually put the suction catheter in and hit the child, hit the fetus. And for the pro-life side, you guys have to get over your love affair with the baby and think about the whole person, that woman in crisis. So it's kind of like you go after both sides. And so Obamacare is in the news, right? The Affordable Patient Care Act. It's a very noble endeavor to try to take care of the underserved. And yet, as part of this, they're going to be talking about conscience protection this coming week with HHS Secretary Kathy Sebelius. Because what they're saying is that in OBGYN today, if you're pro-life, don't you dare go into OBGYN because you don't have a place. Leave your conscience at the door. And what I'm interested in is kind of having that conversation with you all. One of the interesting things we talk about is that Martin Luther King, this is Black History Month, and I went to Spring Hill College, population 900 in Mobile, Alabama, and I was a history major. Well, Spring Hill College is mentioned in Martin Luther King's letters from a Birmingham jail. And in the middle of that letter, he's talking about his disappointment of why people are not stepping in to help him. And he's writing it to the Christian ministers. And he says, you know, in the end, you know, I at once thought it was bad that people called me extreme. But in the end, there's a lot of great people out there like Jesus and Moses and Martin Luther, and he names a bunch of works. He says, in the end, folks, you're either going to be extreme for justice or for hate. You pick. And it really resonates with me, because this whole idea of this idea of conscience protection. Well, what's interesting is that President Obama at the prayer breakfast recently talked about, he says, you know, when Michelle and I get attacked because no one believes we're Christian, what really matters at that moment is that she and I are true to our conscience and true to our God. And I agree with him on that. I agree with him. On the issue of abortion, I used to really believe in his approach. This whole idea that government should not intrude on private family matters. He remains committed to policies, initiatives, and programs that help prevent unintended pregnancies, support pregnant women and mothers, and encourage healthy relationships, and also promote adoption. He says we commit ourselves more broadly to ensuring our daughters have the same rights, same freedoms, and same opportunities as our sons to fulfill their dreams. So he says this on the anniversary of Roe v. Wade, and at the very same time, we're finding out about that. Oh, come on in. No, please, please, please. This is a friendly audience. This is like the Oprah Winfrey program. We're not, this is not, I really want engagement here. And so what happens is he said, so he's talking about the same opportunities for women, and yet we're finding out about that abortion mill that the abortionist in Philadelphia, Dr. Gosnell, Kermit Gosnell, 69-year-old, got brought up on 8 counts of murder, one 41-year-old woman, and 7 children that he ended their life after they were born. There were jars of fetuses all over his center. He had a door for the poor, and he had a door for the not poor. He did abortions up to week 30. Babies were 3.5 pounds, 4 pounds. The interesting thing with that story, and the reason why I open up with it, is that the Department of Health in the state of Pennsylvania did not investigate that center. And yet they knew about it because it was the 3rd largest OxyContin center in the nation, in the state at the time. And yet since 1993, yeah, come on in, please, please, please. In 1993, they stopped investigating. So the Department of Health looked the other way when it came to this man who was in a very poor section of town aborting pregnant women. They looked the other way. There was a conscious decision because of ideology. Also, the emergency rooms in that area looked the other way when those walking wounded would come into their facility. And this is kind of this challenge, this real challenge. So, I grew up in a great family. I wanted to liberate you women from the chains of your fertility. I believe that fertility hindered you from being a fulfilled woman. That's what I wanted to do. I wanted to break those chains. And so I pursued that approach, meaning I wanted to go and learn the best contraceptives, the best abortions, because I thought fertility was a chain around your pelvis, so to speak. Well, the more I thought that would bring joy and happiness and wholeness and healing, the more I saw just the opposite. So when I listened to young women who are in that crisis pregnancy, that unwanted pregnancy, and once again, many of you here may have had abortions, and many of your friends, and like I said, I'm not throwing stones here, and I'm very sensitive to this, because there's a real issue here. That unwanted pregnancy is a real difficult place to be. And yet that woman would say, Dr. John, I have 3 options. Motherhood, which will definitely not, it'll just wreck my life. Adoption, can't do that because not only did I fail to not get pregnant, but then I'm not good enough to even keep the child. The third, the least difficult option is have an abortion. So I need that service. So what I want to tell you, because you're all pro-life, is that if you think for 1 minute that showing the woman the humanity of the baby, fetal development, is going to help change her heart and mind, you're mistaken. All the focus groups out there, despite what you hear, it's a lot more of a difficult decision. We've been doing this for 38 years. People have been back and forth about politics, and there's still 1.2 million abortions done every year. And so what happens is that you have to look at the pain and suffering of the woman, of her relationships, and not just kind of parrot off, oh, how can you hurt, how can you end the life of another person who's growing? Come on in. Come on in, buddy, no problem. So, that's where I was. I became this by listening to women in my office, in my clinic. When all of you who are in medicine, even if you're an oncologist, you have to listen to your patients. We all have to listen, and that's why there's a crisis in medicine today. Doctors, 2 minutes, in and out, high tech, not high touch. People are running to alternatives. There's a real crisis here. We're not seeing the poor, costs are through the roof. There's a real issue. And at the heart of this particular topic is this abortion issue. So here I was in my residency, and I was trying to do all of this to find people's freedom, and I really wasn't finding it. So my experience was kind of coming in contact with, so I began to look at the data. And I began to realize that the abortion industry is unregulated. It's only volunteer reporting. We don't know technically how many, how much, when, and how, and where. Because there's no system in place. There's a general system that people try to report to the National Abortion Rights Action League, kind of their reporting industry, but it's all internally reported. There's no state or governmental reasons. And so that was kind of, there's no oversight. Number two, we used to see a lot of, a disproportion of African American women. They make up 12% of the population, yet 33% of all abortions are done on women of color. 33%. What's interesting is that African American women have 3 times the higher risk of prematurity. Because there's some really good studies out there, such as the evidence from Australia. They looked at 250,000 singleton births. With 1 abortion, there's a 60% increase in preterm birth. After 2 abortions, it's a 150% rise. After 3, it's 460%. And at 4 or more abortions, it's 800%. We now know that preterm birth is a big deal. The March of Dimes is against it. We're looking at the in vitro fertilization world. Twins make a baby come a little early, and prematurity is a real issue. And yet this evidence between the number of abortions and prematurity is out there. And yet the American College of OBGYN says, no, there's really no good statistical data to show that there's really a harm. That was one interest. The other interest is that cerebral palsy increases with very low birth weight babies. So babies that are born under 3 pounds, they have like a, what's this statistic? 55 times higher risk of cerebral palsy. Well, guess what? We're also finding data that shows that in the African American community, they have 2 times the higher risk of other minorities of delivering a baby earlier than 37 weeks, and they have 3 times more common rise in babies born before 32 weeks. I began to see this data, and it really was something alarming to me. We looked about substance abuse disorders. 2 times, women who abort have 2 times the higher risk of substance abuse than non-aborters. And we see that also for depression. Marijuana use, 10 times more. There's illicit drugs. It's an interesting association. And I began to see this, but I had to go elsewhere to look for this data. And so what happens is, as I'm going through this, they talked about suicide attempts. Do you know there's a 4 times higher risk for a suicide attempt of a woman who has an abortion over a woman who birthed a child? That's like the British Medical Journal right around the year 2000. In the year following a pregnancy event, women who chose abortion have a 6 times higher risk of suicide, a suicide rate 6 times higher, that peaks just after the abortion and around the due date. You don't hear that. Because when people look at you in this country, the American College says, when you look at all studies put together, there's really no increase in morbidity or mortality. In fact, there's never been a study to show that abortion increases health and wellness either. And lastly, it's the risk of breast cancer. Here we go, over and over and over again, and we talk about family risks and other risk factors of breast cancer for all of you women. Oh, come on in, buddy. No problem, please. Please. I think there's a seat back in that corner there. 2 pregnancy-related independent risk factors for breast cancer are, 1, the protective effect of a first full-term pregnancy, and induced abortion. In this country, there were 16, as of 2006, there were 16 studies in this country that showed the association, or looking at the association between breast cancer and abortion. 13 out of 16 showed a correlation. 8 out of the 13 showed a statistically significant correlation. And yet, when you ask, the ideology of the right to choose says no, there is not. And, oh, come on in, sir, if you want. Sure. And so what happens is that we've had these issues. So what's happened is that I said, you know what, I just think there's got to be a better way. And so my wife and I, we started a medical center. Oh, it's okay, buddy. We started a practice where abortion was not a part of our approach. Because we began to believe that abortion is not good health care. it's not healthy. And so